So a warm welcome to all of our Samaritan Advantage members and attendees while you're being welcomed from the lobby into our Samaritan Advantage Lunch and Learn webinar for today, November 9th, 2021. It's amazing how quickly this calendar year is going, and we're already making plans for Thanksgiving 2021 and the holidays of 2021 when COVID first started in March of, what was it, 2020 now. Well, at least in this area, it started in other parts of the world back in that earlier winter part of 2019. But we wouldn't have thought that we were really going to be at the place where we're at today, all those 18 months plus ago. So really excited and honored that you're able to join us today. And we have two great presenters from within our system, Samaritan Health Services, that are going to be giving presentations on COVID-19 and what we can expect moving forward. The first of our presenters is Helen Beaman, and our second presenter is Dr. Adam Brady, who is head of our SHS Corona Task Force and also an infectious disease specialist. You will hear more of their bios as we get going a little later on. For purposes of some rule tending to for the Advantage Lunch and Learn, please keep your voices on mute unless you're going to be asking a question later on in the discussion. It helps just decrease some of that feedback. Also, if this is your first time attending Teams meetings and you're seeing your screen freeze, sometimes what you might need to do, it's based on your own Wi-Fi in your home. And you may have to reconnect on Teams or put your camera off and just listen in. And that sometimes will help with some of those Wi-Fi or bandwidth issues. So without further ado, we are going to get going with our Lunch and Learn. We are going to have the video recording sent out to you at a later date. And attached with that video recording email is also a post survey to fill out so we can hear how we did. Also part of that survey, we usually ask you ideas and upcoming Advantage Lunch and Learn webinar discussion items. So feel free to let us know what you would like to learn about in the future. And also as our thank you, because we can't get together live and have a lunch and learn event, we have a Subway $15 gift certificate that will be mailed out to you by snail mail. So it will go out to your mailboxes instead of anything done by email as a way to say thank you to you. So without further ado, I'm going to turn it over to my colleague Helen to introduce herself and then to give her component of today's discussion. Helen.
We're going to talk today about strategies for wellness during COVID-19. My talk will go for about 20 minutes and then you will get to hear the other presenter. So I'll just rely on our meeting moderators to let me know if I need to stop. And then if you didn't already see, we will answer any questions at the end of both talks so that both presenters have the most time possible to give you information. Again, my name is Helen Beaman. I have a master's of social work and I'm a licensed clinical social worker in the state of Oregon. And I've been serving in a variety of different roles within Linn, Benton, and Lincoln counties. And I come to you today with a little over 22 years of experience in the medical, social, and human service fields. Some of you may have even heard me speak at other lunch and learns over the last couple of years in my last role. And I've also done a lot of different talks for other agencies and organizations. I'm going to start today by going over briefly some of COVID-19's impacts on our mental wellness. Then we'll talk about normal responses to a crisis, which, yes, I'm calling COVID-19 a crisis. And if it hasn't felt like that to you, that is awesome. But I think for many of us, it's felt a lot like a big crisis. So we'll look at what some common responses have been to this. And we'll talk about anxiety and depression. We'll go over what I mean when I say anxiety and depression, what that looks like as far as signs and symptoms. Then we'll talk about some coping strategies that you can use. And then we'll look at some resources that are available to you within the community. So impact on mental wellness. It's interesting now that interesting, not in a fun way, but from a psychological standpoint to me, that our brain has now associated plenty of normal everyday things with being really, really fearful experiences. So things like leaving the house, being in a public setting, even sometimes us physically touching things, your brain may now perceive as threats to your safety. I don't know if anyone else has had this experience. I have it just about every time I watch TV, whether it's a TV series or a movie. I think the first time I noticed it recently, I was trying to go back and watch the really popular TV series Friends. And this was, of course, created in the 90s. And I just felt this jolt of panic while I was watching one of the episodes. And of course, I'm a behaviorist, so I'm going to try to dial in and figure out what is happening for me right now. And I realized that a group of them had come in for a group hug, I think in a little coffee shop setting. And my brain was like, whoa, danger, right? Why is everyone getting so close? Where are their masks? And this is an example of how my brain has now started to encode some what used to be normal things with very real threats to safety. So if these odd occurrences have happened to you, just know that it makes sense from a psychological standpoint. We've seen an increase in agoraphobia. So people see this differently, but I think of it as a fear of kind of leaving the house or fear of being in social settings. So we've seen an uptick in this experience due to the pandemic. We've seen an increase in depression, anxiety, social isolation, and loneliness. So to clarify this bullet point, I would say some of this is an increase in the perception of experiencing things like depression, anxiety, feeling lonely, and there's also been an increase in the levels of diagnosable things that we're seeing in a clinical setting. The pandemic has also greatly limited our access to many of the healthy behaviors and self-care options that many of us use to manage our wellness and our health, or when we have experienced depression or anxiety, all the ways that we get back connected into our communities and regain a sense of health and wellness. I can tell you as a behaviorist, it's been really, really challenging for my position because all of my go-tos, all of the things that I would normally recommend for people to engage in, they have barriers now because of the pandemic. I can't tell people, oh, try to get into a group exercise class. The risk for each person is going to vary quite a bit. And so I don't have a lot of options as far as healthy behaviors and things that I would normally just offer to people. So it's really made it challenging to take good care of ourselves through all of this. Lastly, this has had a huge impact on grief and loss. So not only have many of our lives been touched by loss, specifically from the pandemic, but we've had normative losses throughout this time. And we have seen a huge disconnection from our loved ones, being able to be near them, being able to connect with them in all the ways. And then when someone has become sick or has passed, we often are not able to be at their bedside. And we've also been unable, to some degree, I think it's getting better now, but in the thick of things, we were not able to have our funerals and other grief and loss rituals that would normally allow us to receive social support for those losses. So just to briefly go over normal responses to crisis, I want to go over this slide primarily because I want you to know that wherever you're at and however this experience has felt to you, it's normal. Whether it's been really awful, very scary, weird, I promise you it's normal. Other people are going through really, really bizarre kind of experiences of this whole pandemic. So if you've felt fearful at any point, questioning, am I safe? Will we be okay? Is the world coming to an end? I don't know about your brain, but mine can get pretty dramatic and creative. So all of those things are normal. Feelings of anger, which I know a lot of people tangle with this, especially if you're a pretty even keel, soft-tempered type of person, but many people have felt angry at different points through this process, questioning why we're not prepared for something like this, sometimes questioning leadership. And, you know, the answer is nobody was really prepared for anything like this, but definitely feeling resentment or frustration is very normal. Feeling confused or frustrated. So what should I do right now? What does the future look like for me, for people that I love, things like that. Very, very normal. Experiencing guilt or self-blame. Should I have had a better plan? And then also this guilt around, it's almost survivor's guilt. So if things have gone okay for you during the pandemic, while you're simultaneously seeing so many people experiencing really, really challenging dynamics, a lot of us tend to feel guilty if we haven't been hit quite as hard by the impact of the pandemic. Shame and humiliation. Many people, if you're trying to, you know, not air your dirty laundry, so to speak, you're trying to keep things to yourself. You don't want to talk to your friends and family about the experiences that you're having with the pandemic. We often feel very siloed and we feel like maybe we're the only ones experiencing these things. So I urge you, if you feel comfortable and you have good relationships with friends or family, if you let them know what you're experiencing, the odds are very likely that your friends and family are experiencing similar things. So some of us have had this experience where we feel like we're handling it much poorly compared to our peers, and that often is not the case. So sorrow and grief, definitely missing our routines, missing our friends, just really everything. There's been so much loss in probably every way possible throughout this entire pandemic, that adjusting to the new normal is going to be a very difficult dynamic for many of us. So what is anxiety? For those of you who can't see the images here, this is a picture of an older adult female, and it says on her forehead, "How will tomorrow look?" And many of us tangle with anxiety at some point in our lives. But I think in a situation like this, anxiety is really running rampant. If we were in person, I would open things up to you and ask you to start brainstorming what anxiety means to you, what it looks like to you, feels like to you. This is kind of the overarching description that I provide people with. So thinking about anxiety, we refer to it in the clinical setting as generalized anxiety disorder. It's a common but serious mood disorder, and the impact that anxiety can have on a person is continuum based. And so we can see very little anxiety that people maybe live with on a daily basis. It doesn't necessarily impact everything that they do, and they can manage it very well, all the way to the other end of that spectrum, where it can be really crippling for people if it's not managed well. Anxiety disorders, like generalized anxiety disorder, differs from normal feelings of nervousness or anxiousness that we attribute to just kind of being part of human, and it involves excessive fear or anxiety. And generalized anxiety disorder involves persistent and excessive worry that impacts daily activities in multiple domains of your life. And my slides are moving the opposite direction. All right, so what are the symptoms of anxiety? Excessive worry. Okay, a lot of times, especially with generalized anxiety disorder, your worries will often be very random and diverse. Many times they'll be about things that are pretty unlikely to happen, which the pandemic has shaken things up because most of us never in a million years in our lifetimes would have thought to worry about a pandemic type situation. Feelings of impending doom. If you've never had this symptom, that's awesome because it's pretty miserable. I can tell you I've experienced this myself. But for those of you who have experienced feelings of impending doom, I think many of us would describe it as this gut sense, right, in your stomach that says, like, I shouldn't get out of bed today, or today is going to be a very bad, awful day. And this is something that's generated by your brain when you're experiencing anxiety. Many people have nausea or other gastro issues. Heart palpitations. So sometimes people will feel like their heart is really beating out of their chest, very powerful and rapid. Some people experience experience trembling. Some people can feel chest pain or chest pressure. I liken it to as if an elephant is sitting on your chest and you just feel like you can't take a deep, full breath of air. Many people do experience difficulty breathing, muscle tension, body aches, racing and intrusive thoughts. This is kind of hallmark for anxiety. So these are thoughts that just pop into your brain. You have not asked them to be there, and they just keep rolling around and around and around, begging for your attention. Many people experience fatigue. This is exhausting to feel anxious. Some people experience sweating. A lot of people will call it stress sweating, which it feels very different. It can even smell differently than regular sweating. So this is your body just really in a state of stress. Paresthesia, or some tingling sensations. Often people might feel this in their hands or other extremities. Hypervigilance. So this is the experience of being very on guard. You might startle easily, be checking over your back, just kind of overall very worried about your surroundings. Older adults in particular are more likely to experience irritability or having a shorter fuse when they're feeling anxious. I think being anxious just takes so much of your energy that it can shorten your fuse. If you're normally a very patient person, just know that that's not broken. And once your anxiety is managed, that will return back to you being a patient person. Psychomotor agitation, this is a fancy way of just saying really physically restless. Some people have difficulty sitting still, or they might be, bouncing a leg or doing some other repetitive motion, just as kind of a physical way that the stress is trying to eke out. And then we often see changes in sleep or changes in diet. So both of these symptoms can go either way. Some people will try to sleep too much, or they won't be able to sleep at all. And likewise with diet changes, some people will eat more, eat less, or even make different dietary choices depending on their response to the stress. So what is depression? Overarching description. When we're talking about depression, I'm referring to major depressive disorder or clinical depression. This is a common but serious mood disorder. Again, we don't consider it a normative part of aging, but at any given point, about 5% of older adults are experiencing a depressive episode. So it's something that if you've been diagnosed with depression in the past, it makes you a little bit more vulnerable to experiencing depressive episodes, as you go through life. But it's something that can come and go in our lives. It causes severe symptoms that affect how you feel, how you think, and handle daily activities. It impacts some of our most basic functioning, like sleeping, eating, socializing. And to be diagnosed with clinical depression, the symptoms have to be present for at least 2 weeks. Thinking about it before we break into actual signs and symptoms, if you have ever felt very tired, helpless, and hopeless, if you notice that you've lost interest in many of the activities and interests that you normally enjoy, if you have difficulty getting things done, sleeping, eating, and getting your normal functioning taken care of throughout the day, and if you felt that way more days than not for more than 2 weeks, you might be dealing with depression. So the symptoms are depression. You'll notice that some of them are the same as anxiety. Anxiety and depression don't play nice in the sandbox, so to speak. So they do have some similar things, and there is a causal link between them. Sometimes if we are depressed for long enough, or if we're anxious long enough, it can really shift our brain chemistry. So anhedonia, I'm not sure if all of you have heard this term, but it's a pretty clinical term, and it refers to that characteristic of the loss of interest or the inability to experience joy. And this would be something that many people don't necessarily tune into unless we ask them about it. So it's that part about thinking of like, what would you do to cheer yourself up, or what would you do to go have fun and feel joy if you were having a hard time? And if you were to go and do that, would it still work for you? And sometimes when we're feeling depressed, those things just can't bring us joy. They can't break through. And that is a really, really big indication that you might want to have a conversation with your primary care doctor or your behavioral mental health provider that, just to make sure that you're doing okay and you have everything that you can going to help you feel better. Again, we see changes in sleep, diet, and weight, feelings of fatigue. For many people experiencing depression, I'd say fatigue, just feeling like you have zero energy, is very, very common. It's one of the most challenging factors in treating depression too, because a lot of the things that help manage depression involve getting you moving, getting you socializing, getting you, re-engaged in activities that are helpful for you and meaningful for you. And when you feel so wiped out, that's one of the biggest things to overcome in managing depression. Many people experience difficulty concentrating, focusing, getting things done from start to finish, even memory issues. A lot of times people come to me in the clinics and they might be concerned that they have a brain disease like Alzheimer's or some type of dementia. And I reassure them, there's a lot that can look similar. So we always make sure that we rule out depression. Even when people are grieving a loss or several losses, it can have a lot of those memory and cognitive functioning symptoms. If your depression is really, really bad, some people experience psychotic symptoms, which a lot of people then get nervous that they have some sort of really serious mental disorder, but it is possible for you to experience delusional thinking, hallucinations, things like that when you're in the thick of depression. And then thoughts about death can be definitely a sign or symptom of depression. So this is when we're thinking about, what if I just wasn't here tomorrow? What if I didn't wake up in the morning? And I define these in two separate bullet points because suicidal ideation, which is our last bullet point, this is very different. This is when someone is really feeling entirely hopeless and they are actually thinking about ending their own life. So certainly those are the big red flags with depression, and they are absolutely a result of when your brain is in this state. So muscle tension, body aches, again, that is a shared symptom with anxiety, but depression physically hurts. We often see people with a disheveled appearance. It takes a lot of energy to keep ourselves put together. So a lot of times this will be something that gets, falls by the wayside when you're feeling depressed. Feelings of guilt. This is a way that our thinking changes when we're depressed. Overwhelming sense of sadness, feeling hopeless, having a sense of social isolation or choosing to withdraw, mood swings and irritability, anxiety, and psychomotor retardation or psychomotor agitation, which again, it can go either way with depression. Some people become very physically restless and other people have the complete opposite. And if you've ever experienced this or seen a family or a friend experience this, when someone has such slowed psychomotor responses, I've seen people and they are moving so slowly, speaking so slowly, they actually kind of look like the zombie version of themselves. So sometimes it can be very, very apparent when someone's struggling with depression. So why do we care? Why is it so important that we have this conversation and that we understand how to recognize signs and symptoms of depression and anxiety, and then do whatever we can to get ourselves feeling better? These things impact our physical health, they impact our emotional well-being, our relationships, our social functioning, and overall our well-being and health, our quality of life. So this slide is just a snapshot to show you a couple different ways that you can approach coping for depression or anxiety, or if you're feeling socially isolated or lonely. And I use a lot of words that, we kind of use in my profession, but they refer to pretty basic things. And as we go through the next couple of slides, I'll tell you different ways that you could get in touch with someone who does the type of work that I do, and they would be able to give you much more detail on these things. So behavioral activation is one of our first recommendations. It can be really hard if you're feeling low energy, fatigue, things like that, but it's just a fancy way of saying get moving. Humans are not designed to be sedentary, so our first thing that we think about is how can we get you moving? How can we get you engaged in some sort of meaningful or pleasurable, if we're lucky, physical activity? I don't talk about the E word, which is exercise. You don't have to go to a gym. You don't have to go buy running shoes and train for a marathon. Just getting up and moving your body, it will be very meaningful. Any ways that you can reduce stress in your life, the things that you can control, obviously, are your low-hanging fruit. Anything else, you might want to work with somebody and talk about ways that you can try to have those stressors that are not under your control be less impactful on your health. Diaphragmatic breathing exercises. So if you can see the image in front of you, that blue square down at the bottom, this is an example of one type of diaphragmatic breathing where we would help you basically calm your body and kick it out of a stress response, which if you're experiencing that, for some people, this helps them break out of a panic attack or an anxiety attack. But for other people, it can be really useful for a number of different things. And then grounding. I normally refer to it as sensory grounding. The image of the person with their feet in the grass is very literally a type of grounding, reconnects us to the present tense, which is just a really sneaky way that we distract our brains from whatever it's really worried about by drawing it into focusing on the present through using all of our senses. Other ways to get support locally. Lincoln County Mental Health is available to you. Samaritan Mental Health. Samaritan Behavioral Health. So the behavioral health refers to people like myself who are embedded within our primary care and family medicine clinics. We have a couple people that are in some of our specialty clinics as well. And then our mental health, those are our providers that do traditional mental health therapy. If you have any questions about getting connected to one of those providers, I recommend that you follow up with your primary care provider. If you're interested in doing private practice, then you can go on to psychologytoday.com, and that's listed as our very last bullet point on this slide. You don't even have to spell it right. The internet will know where you want to go. And then once you get onto that website, you can type in your zip code. And then I recommend that you use the filters on that site after you typed in your zip code and just select your insurance, okay? And then filter that so that you know which providers will be covering the services for you. You can also look at pastoral counseling options if you're already connected, and peer counseling groups, which there's a number of different counseling groups in every community. Sometimes your primary care doctor might be able to help you get in tune. Otherwise, you can call your county mental health and ask them what's available. Or if you're connected to any mental health or behavioral health provider, we usually have our finger on the pulse of those things, so we can guide you. So last, we're just going to cover a couple really basic strategies on how to navigate social isolation, loneliness during the pandemic. I call this creating a new normal. We can't change what's going on, so I recommend that you plan your information diet. Now, this means if watching the news and every morning you wake up, you reach for some sort of tablet or phone or computer and read up on COVID-19 and things that are going on, you might imagine that that contributes to your stress. So just make sure that you are limiting that as necessary for what you can handle. I immediately had to put some structure in on that and just say, you know, at this time every day, I get to have 10 minutes and I can peruse and make sure that I'm well informed, that I know what I need to know about what's changing, and then that's it, and I'm cut off. And that was when we were on lockdown. So, you know, I could try to justify needing more information, but realistically, there wasn't any place that I was going to be going. And so I had to be really strict with myself so that I didn't create more anxiety. Try to maintain your routines and structure as much as possible. If things have really gradually fallen apart for you, start building back your routines and structure. It's so important for us. Try to maintain healthy eating. Try to maintain your sleep schedules. Really, it's a back to basics situation with the pandemic. And if you can, do light to moderate physical activity, whatever your primary care doctor is advising, but making sure that we just don't get too sedentary. It's certainly been limiting to try to get out and do all the things. I miss being able to go to exercise classes, which was one of the main ways that I was successful in actually exercising, was that I knew I was accountable to go somewhere at a certain time and show up. And so it is a little bit more challenging, but it's very important. Use this time to find a new hobby. Okay, so obviously if you have hobbies that have just fallen by the wayside, try to pick those things up and get going again. I just put a couple of options on here. Of course, everybody's different in the things that they enjoy, but thinking about crocheting, knitting, things that you can do from home that are relatively inexpensive, online crafting tutorials, reading. I have a huge stack of books that I finally have time to read now since I can't go anywhere else. Online cooking tutorials, bird watching. try to learn something new. Okay, this is neuroprotective, this is cardioprotective, so keep that brain working. If you wanted to learn a new language, take up photography, just dancing, that's something you can do in your own home, free of charge. Learning how to use a new technology or learning how to use a new feature or application or software with technology that you already know. Some of the ways that we can do this and get kind of buy one, get one free, if you will, is learning how to use online grocery delivery, learning how to use, mail order prescription services, FaceTime, Skype, all of those things. We have kind of those secondary benefits now that we're cooped up for the time being. I urge you to reconnect with family and friends. I don't know about you, but I love receiving actual letters, not bills in the mail. So write a letter, write an email. It gives you an excuse to find some pretty new stationery. Check in on family and friends by phone or by text. It will help you just as much as it helps them. And try to take advantage of this time. I think if we forget that perception plays such a huge role in our experience of life, you can reframe this. This is a time that the universe has kind of said, we're all slowing down, whether you like it or not. So just take it for what it is. Try to use this as a time to rest and relax. This is a great opportunity to reevaluate your current values and your goals and make sure that once things get going again, that you are living and doing things that, are consistent with what your values are. And you can create future goals for yourself. If you need someone to listen, the Friendship Line is a California-based resource. It is a 1-800 number. So if you're using a cell phone, just remember this may use your minutes, but if you're on a landline, it will be toll-free. It's completely confidential and it's a peer-based resource. So it's not going to be a 20-something who picks up the phone right out of graduate school. These are not clinicians. They are peers, and they are there to help any person age 60 years of age or older, any adult with a disability, 18 years of age or older, or any caregiver of older adults or persons with disabilities. And you don't have to prove any of this. You can just call and they will be, a person who can listen and connect. The David Rompery Oregon Warmline is the Oregon version of the Friendship Line. It is a peer-run program. It's not 24/7 like the Friendship Line, but it's got really, really great hours. I think they're 7 days a week. And again, it's an 800 number. And we can send you, either through snail mail or through email, we can send you a link for these resources so you have the information in front of you. And then if you or anyone you know is experiencing suicidal ideation, we want to make sure that you have this line and this resource. This is a resource that can potentially save a life. So this is a crisis line, different from the 2 warm lines we just talked about. This is if somebody's in serious threat, and these folks will help that person or yourself stay safe during your moment of crisis and get you connected with the things that you need to be safe. And that is the last of my slides. So I will turn it back over, and Dr. Brady is going to take it from here.
Great. Thank you so much, Helen. And while Dr. Brady is getting his information up on the screen, I just wanted to say thank you to you that the information you provided is so necessary for each and every one of us as we're making our way through the pandemic. Dr. Brady is going to be next, and then we're going to have time at the very end of Dr. Brady's discussions to answer any questions, both from Helen and from Dr. Brady. So I will let Dr. Brady take it away and do introductions, and then let us know the latest and greatest on COVID-19.
All right, thank you, Dr. McKenna. Thanks, Helen, for an excellent talk. So I'm happy to be here today. Again, my name is Adam Brady. I'm an infectious disease doctor here at Samaritan. I'm based in Corvallis, but I've been help coordinating the Samaritan's COVID-19 response throughout Linn, Benton, and Lincoln counties since actually January of 2020. So we're almost 2 years into this as far as the planning stages go. But I'm happy to talk today about COVID-19 vaccines. Well, as we get started here, as far as an agenda, I'll talk a little bit about myself, but the majority want to talk about the current state of COVID-19 vaccinations. Again, COVID-19, the landscape of vaccines and who should get vaccinated, who should get a booster has become very complicated. So hopefully we can kind of shed some light on that today. Again, probably enough for an hour-long talk on its own, but I think we'll hit the high-level points and hopefully leave plenty of time for questions. We'll also go through, like I mentioned, local vaccination rates and also clarify the role of boosters for folks as well. So about me, I did my undergraduate degree here in Corvallis at Oregon State in microbiology. I did my medical school at the Royal College of Surgeons in Dublin, Ireland, where I spent 4 years in medical school. I did residency at University of Massachusetts in Worcester, Massachusetts, and then finally got back home to Oregon, where I did my fellowship in infectious disease. And I've been at Samaritan in my current role as an infectious disease clinician from 2016 through the current time. And again, I've been chairing our COVID-19 task force, which kind of, at least early on, really oversaw our response and continues to be active and trying to help keep patients and employees at Samaritan safe while we navigate the ongoing pandemic. So just to jump right in, this is a slide that's kind of busy, but shows the 3 currently available COVID-19 vaccines. And over time, I'm having to add to this table more and more, which I suppose is a good thing because more and more people are eligible for vaccination. So if we start in the first row here, the Pfizer, or sometimes called the BioNTech vaccine, is an mRNA vaccine. That's the technology that it uses to train our bodies how to react and fight COVID-19. For ages 16 and above, that's been actually FDA approved, and that's where this brand name called Comirnaty comes in. It's the same vaccine, but it's been FDA approved now for people age 16 and up. EUA means emergency use authorization. So this is a tool that the FDA has to allow use of a vaccine when the benefits far outweigh the risks in time of emergency. And that's, we're currently in the emergency state still of the pandemic as it drags on. So that's available under emergency use for now newly people ages 5 to 11 and also 12 to 15. The Moderna vaccine uses very similar technology as the Pfizer vaccine. It uses mRNA or messenger RNA. And that's authorized for use in people 18 and above. And then there's the Janssen vaccine, or Johnson & Johnson, which is more commonly known, which uses a little bit different way of training our body how to fight COVID. It's something called an adenoviral vector vaccine. I'm not going to go into detail about how the vaccines work, again, because we're limited on time, but just to know that that's a vaccine that's available for 18 and above as well. So over time, again, since vaccines were widely available, or I suppose became available back in the middle part of December 2020, there's been varying sort of success stories in different countries. In the United States, while we started very fast, United States, you can see here in the maroon line, started very fast and one of the earliest to start vaccinating people back then in December of 2020. But over time, other countries have done a better job at vaccinating more shares of their population. You can see Portugal, especially, with well over 90% now of their or nearly 90% of their population vaccinated for COVID-19. And the United States have fallen behind many countries with our current vaccination rate, which is in the mid to upper 60% range of the total population. So more locally, there's also kind of a wide spread of vaccination rates, even in our sort of 3-county area. So United States, like I mentioned, 68% of all of the entire population, this is just not just adults, but the entire population of the country has received at least 1 dose of COVID-19 vaccine. Oregon is right around there at 67% of the population being fully vaccinated or having 1 dose of vaccine. Now, Lincoln County and Benton County have higher rates than the state and the countrywide average, 71 and 73% of people having first doses of vaccine, respectively. But Linn County has lagged behind somewhat. 55% of the population of Linn County has received at least 1 dose of COVID-19 vaccine. In Oregon, if we look at Oregon over time, also as a state, like I mentioned, we're at 67. If we round up 66.5%, 67%, or 1 in 3 of 2 in 3 people in Oregon have been vaccinated with at least 1 dose of vaccine. And we had, really steep increase in the rates of vaccinations early on through February and through June, but it's really been a plateau and kind of a slog since then to increase vaccination rates. But nevertheless, we are making some progress. The goal of the state is to get 80% of the total population vaccinated in Oregon. And on the bottom here, we have about 576,000 people to go before we reach 80% of the population vaccinated. Now down here in green, as of October, late September, so we started giving extra doses or booster doses of vaccine, and 10% of the population has actually received a booster dose, and that's what we're going to spend the most of the talk here, rest of the talk talking about. So, question I get all the time is, why do some people need boosters? Does that mean the vaccine isn't working, or maybe I don't want to get the vaccine at all because I'm just going to have to get a booster, or maybe get a booster on a regular interval in the future. But the reason why some people need boosters is that, early on things were great. The vaccines were extremely effective at preventing COVID-19 infection. When the studies first came out and when, real world information started coming in, the vaccine prevented, made it 95% less likely that you would get COVID-19 compared to somebody who was unvaccinated. So, that's what we call an efficacy rate, 95% effective at preventing COVID-19, which was great. But over time, that number has gone down, and it's probably somewhere now in after 2 doses of vaccine for mRNA, at least, it's gone down because of a couple of reasons, and probably around 70% or so. So over time, immune system, your immunity can wane, which means over time you can become more successful or more susceptible to infection. So now that happened around the same time, about 6 months after most people got vaccinated, the Delta variant came along, and the Delta variant was more infectious. It was better at infecting people. And that combination caused, the 95% vaccination effectiveness rate to go down. But thankfully, the vaccines have remained very effective at preventing severe infections and preventing death from COVID-19 for most people. And we'll talk about that in a little bit more detail as well. The effectiveness for preventing any infection at all has gone down somewhat. So first of all, what is a booster dose? And this is just a schematic looking at the a theoretical mRNA vaccine, for example. And so how you can look at this is on this side of things, the higher the line is on this side where it says antibodies, the more antibodies you have to fight COVID-19. Antibodies are a way that we can prevent COVID from causing an infection or causing a severe infection. Now, all of us before we got vaccinated, we didn't really have a whole lot of antibodies to COVID-19 because this is a brand new virus. So what happens is, if after you get your first dose, your body makes some antibodies to COVID-19, and but it's not a ton, it's not full protection, and that may go down a little bit. Now, after the second dose, you make even more antibodies, and those are more prolonged over time. But as time has gone on here, you can see that levels of antibodies have gone down, and then this big yellow virus picture here is supposed to represent the Delta variant. So when the Delta variant came along, there was a decrease in the effectiveness of the vaccine, just because that time has gone along quite a bit as well. And that's where the third dose or the booster doses come in to really restore that antibody level, restore that protection against COVID-19 that we saw early on in the vaccine campaign. So, and I think to answer one of the issues I mentioned before is I hear from a lot of people that says, oh, you can get COVID-19 even if you're vaccinated, so I'm just not going to bother. It doesn't make any sense for me to get vaccinated. And so, I think while that's true, again, no vaccine has prevented 100% of the infections that it's designed to protect against. It doesn't really show the whole picture. So what this schematic is showing the spectrum of COVID-19 infection in an unvaccinated person. So again, there are a few people, or a portion of people here who might remain asymptomatic, so they have no symptoms at all. Another portion that could be paucisymptomatic, which means very few symptoms from COVID-19. And then as we step up, there's folks that have a cold-like illness, maybe a flu-like illness. And then there's a significant chunk of people who might become hospitalized, require the ICU, or even die from COVID-19. And that's kind of what that spectrum looks like in an unvaccinated person. Now, if we look at someone who was vaccinated recently, say in the last month or two or 3, it's very effective still at preventing cases of infection. So, the majority of the time, you're not getting infected at all if you're vaccinated. Now, it is true that you can get COVID-19 if you are vaccinated, but, all of this we see up here, asymptomatic, quasi-symptomatic, cold, flu-like illness, hospitalization, death, and ICU, it's all crammed in, right over here. So it's all much more rare than if you were unvaccinated in the first place. Now, over time, what's happened is, the vaccine has become less effective. So this is somebody perhaps 6 months after they've completed their vaccination, where again, you're having protection against the vaccine, but it's not like it was back, right after you were vaccinated. So, and again, after you're fully vaccinated, the spectrum shifts quite a bit as well. You can see there are very few people being hospitalized. There's even fewer people dying from COVID-19. And if you happen to get infected, you're likely to have either no symptoms at all or very few symptoms or a cold-like illness. And, the rate of severe infection after you're fully vaccinated, even if you're 6 months after vaccination, is low. Not a lot of people. And again, there are exceptions, but again, the vast majority of folks, you're preventing severe infection or hospitalization and death from COVID-19. So our goal with booster doses is essentially to return to how it looks here in the middle, where most people don't get infected at all, and we reduce the amount of people being hospitalized or having potential for severe infection. So, after the Delta variant came along, studies have shown that fully vaccinated people, and this is just another way to say what we were saying before on the previous slide, fully vaccinated people had a reduced risk of infection by 5 times compared to someone who was unvaccinated. They were 10 times less likely to be hospitalized and 10 times less likely to die. Or another way to say it is, if you're unvaccinated, you're 5 times more likely to get COVID-19 in the first place, and you're over 10 times more likely to either get hospitalized or die from COVID-19 compared to someone like you who had been fully vaccinated. So now, not everyone, everyone is a little bit different. Our immune systems are different as we age, and not everyone, was recommended initially to get a booster dose. So for the Pfizer and Moderna vaccines, which are those 2-dose mRNA vaccines, people who are 65 years and older seem to have a higher risk of severe infection and hospitalization the further out you get from a COVID-19 vaccine series. So everyone 65 years and older is recommended to get a 3rd dose of either Pfizer or Moderna vaccine 6 months after their 2nd dose. Now, that's a full dose of the Pfizer vaccine, and that's a half dose of the Moderna vaccine as well. But people who are giving vaccine should be able to know what dose that you need. They also recommend that people 18 and up that are in high-risk situations, like living in long-term care, who have underlying medical conditions, or live and work in high-risk settings, consider getting a booster as well. Now, the Johnson & Johnson vaccine has become even less effective over time than the mRNA vaccines. And again, that's a single-dose vaccine. So the CDC has recommended that everyone aged 18 or older get a 2nd dose of vaccine at least 2 months after their 1st dose of the J&J vaccine as well. So how does that look then for the current landscape? And I kind of work more visually than words, so hopefully this kind of helps show what the full landscape looks like. This is starting with the Pfizer vaccine, and like I mentioned, the Pfizer vaccine was recently authorized for use in ages 5 to 11. No booster is recommended for ages 5 to 11. It's just a 2-dose vaccine, and whether or not there will be boosters in the future, I think time will tell. Now, if you're 12 and over and you're not significantly immunocompromised, meaning you have a relatively normal immune system, it's recommended that your primary series, or the regular course of Pfizer vaccine, is 2 doses separated by 21 days. If you have significant immune compromise, like moderate or severe, they call it, these are things like on chemotherapy, or you have high doses of steroids that you take, or you have a bone marrow transplant, you're actually recommended to get 3 doses up front of the COVID-19 vaccine, separated by 3 weeks after the first and 4 weeks after the second. Now, where the booster doses come in here is if you're 18 and older and it's been 6 months since you've gotten the vaccine and you meet one of those criteria we talked about before, it's recommended to get a booster dose, which would be either a 3rd dose if you're not immunocompromised, or actually a 4th dose if you are immunocompromised. And you can actually get Pfizer, Moderna, or Johnson & Johnson as your booster dose. And we'll talk about a little bit of the nuance there, what you should choose in a little while. Moderna, a little bit simpler because we don't have pediatric vaccines yet. It's just 18 and above, but same idea. We have 28 days between the first 2 doses. And then we have a 3 doses for people who are immune compromised. And again, 6 months or 6 months or so after that last dose, people who are eligible can get a booster dose of either vaccine, Pfizer, Moderna, or Johnson & Johnson. Now with the Johnson & Johnson vaccine, again, it's just a single dose up front. And then it's 2 months, and everyone over 18 is recommended to get either Pfizer, Moderna, or Johnson & Johnson to increase the effectiveness of the Johnson & Johnson vaccine. So again, going back to this slide, most people getting, again, this applies to Pfizer and Moderna mostly. Now, first dose, you get your second dose, and now if you've gotten your booster dose, you've had antibodies come back up. And the question we always get, which is why there's a question mark here, is, are we going to have to get boosters every year? Is it going to be every 6 months? And again, the answer to that question isn't known, and it's difficult to know. We do have some vaccine series that are 3 doses, and they confer very long protection. And it may turn out that these vaccines are essentially 3-dose vaccines. But as time goes on, we don't know what COVID-19 is going to look like in, say, another 6 months. And so I think there's a good chance that it could last for a long time, but there's also, it's not out of the realm of possibility that depending on the spread and if any further changes to the virus, we may need additional doses. It's just too soon to know. So booster side effects. Booster side effects seem to be very similar to the previous doses of vaccine. Fever, headache, fatigue, chills, and arm pain seem to be the most common, and serious side effects remain very rare. Now, we mentioned mixing and matching of booster doses, which means you're allowed essentially to choose a different vaccine for your booster than the previous than the vaccine that you had as your original dose. So any vaccine type can be used as a booster dose, but it doesn't seem like all of these vaccines are created equal. So my personal recommendation, again, depends on things like your situation recommendations from your doctor, but it seems, at least in the lab studies, that if you had Pfizer or Moderna for your original vaccine series, it makes the most sense to either get Pfizer or Moderna for your either or for your booster dose. If you had Johnson & Johnson, it seems like getting a second dose of Pfizer or Moderna is probably best. It probably increases your immunity a little bit better than a second dose of the Johnson & Johnson vaccine. Again, assuming that you didn't get the Johnson & Johnson vaccine because you were not able for reasons of allergy, et cetera, to get your initial mRNA vaccine. So in summary, over time, the vaccine effectiveness of COVID-19 vaccines has decreased, and it's gotten lower against preventing just cases of COVID-19. In most people, vaccines remain very effective at preventing severe disease and death from COVID-19. And certain people, especially people over the age of 65, would benefit from a booster dose more than others, and that's where the recommendation came in. Now, even today, Pfizer has asked for authorization for all adults to receive booster doses. I think eventually, with more data coming out, I think we will see a recommendation for all adults to get booster doses of vaccine, but we're not quite there yet from a clinical trial and a data perspective. Side effects are mild, and you can pretty much expect the similar side effects to your initial doses of vaccine, and serious reactions to this vaccine continue to be very rare. So how to get vaccinated, just to wrap up here, samhealth.org/getthevaccine is regularly updated with information on how to access the vaccine through Samaritan and through County Health Department partners. We're doing walk-in vaccines at SamCare Express or drop-in vaccines at SamCare Express in Albany and Corvallis. You can just go and get your booster dose anytime. They're open. Newport Walk-in Clinic and the Samaritan Coastal Clinic in Lincoln City are also open for vaccinations. And then local pharmacies, a whole list there. Most pharmacies around will have vaccines available, and this vaccines.gov/search you can customize based on the type of vaccine and your location, and they'll tell you who has vaccines that are in stock. So just to wrap up, vaccination is really the best way to, one, reduce your chances of getting COVID-19. Again, even with reduced effectiveness, it's the best way to reduce your chance of getting sick from COVID-19. Also makes it less likely that you'll infect other people, including your household members if you do get sick. Dramatically reduces your chances of becoming hospitalized or dying from COVID-19. Protects you and those who work and live with you. And also decreases the impact of COVID-19 on society, which, the impacts have been major, and also the healthcare system. So I know we don't have too much time, but I wanted to thank you all for your attention, and I'm happy to take any questions that you may have.
So thank you all for attending today. And yes, we have time for a few questions for both Dr. Brady and Helen. And what we'll do is I'll try to monitor who might have their hand up, either electronically using the app or just raising your hand, and I'll call upon you. So anybody, or just shout out your questions you might have. I'm just looking at the attendees with the phone numbers to see if I see any hands raised, and I don't. So, Dr. Brady, is there a good place to go to for information that helps decrease any myths, either about vaccines for COVID-19 or any myths about COVID-19 infections? Is there a well-respected place to go for information?
Yeah, it's kind of the Wild West out there, when you're Googling information about COVID-19 vaccines. The CDC, and I don't have the link off the top of my head, maybe I can put it in the chat and find it after we're done here. But the CDC, and through the Department of Health and Human Services, has a pretty good document that addresses common myths and, debunks them essentially about the COVID-19 vaccine. So I can try to get that information out to you.
Okay, thank you. Well, I appreciate everybody's participation today. Looks like both Helen and Dr. Brady had a lot of information your way. And as a reminder, again, we will be sending out this video recording after about a week or so. Give us some time to do some editing. That will show up in your email inbox, and you can rewatch this recording. As well, there will be a survey that's attached to that email, so you can let us know how this session went. Also giving us some thoughts of sessions in the future and topics that you would like to see. And then lastly, just watch for that snail mail Subway $15 gift certificate on behalf of Samaritan Advantage. We're really happy that you are our healthcare members. We as a health plan are very, very happy we're part of an integrated delivery system like Samaritan Health Services, where we have great clinicians in our midst. And at the end of the day, I want you to keep yourselves safe and happy, and we will connect again at our next Advantage Lunch and Learn webinar. So thank you for joining us.